Yeah, it's a real big lump, isn't it?
On this episode,
Bella had obviously suffered major trauma to her tail. She's been really crying loudly.
And there's not the greatest of response there. There's a level of nerve loss or nerve damage. It can go from a significant injury to an absolute nightmare. You want to be damn sure that you're in the right position.
but first,
There's something quite serious going on here. It's not a clean break. We need to do surgery on this leg.
Oh, bless you. It's a complete and utter shock. Probably my worst nightmare. Good boy, Pablo. Good boy. Good boy. Here you come. Good boy.
Hi. How are you?
I'm good, thank you. And you?
Hello. Pablo.
Naomi has brought Pablo in today because she left him at home yesterday, came home to find that he was limping.
Excited to be here, aren't you?
Good boy. Good boy. Good. I tried to pick him up and he's doing this almighty squeal. He just would not move. Come on then. It was absolutely heartbreaking. I just wanted to wrap him up in cotton wool so I could get him to the vets to see what's the matter.
Hi Naomi, how are you? Hi, I'm Scott. How are you? Nice to meet you. Hello, handsome. He's lifting that right leg up, isn't he? What I might do is just get him to have just a little pot around because I'd just like to see what's going on with that leg, if that's all right. Okay. It's quite ginger on that leg, isn't he? Just a bit sensitive. Well, there's definitely something wrong with that right leg. There's no doubt about that. So come on in. That's it. Good boy.
I'm just really hoping that he can just give me some answers and help me find out what's wrong with him.
Is this the first time he's ever had problems with this right leg?
He has had a few incidents before when he was a tiny baby.
Okay.
And then
What had happened on that incident?
He got attacked by another dog on one of his very first walks.
Oh no, what a
And
nightmare.
Not good.
Yeah.
A couple of months later, we went to spend a weekend at doggy daycare and genuinely think he probably just overdid it. We rested him. Within a day, he was back to his sprightly self, absolutely normal.
Okay.
And then this has happened.
Oh dear. Well, let me have a little feel of this leg. Just holding around the shoulders
Up,
there.
come on then.
Okay. Good boy. Let's have a feel.
Good boy. Shh, shh, shh. All right, all right, all right.
Okay.
All right.
Wow, you didn't like that, did you? No, you didn't. Okay. Well, straight away I can feel that the problem's in the hip.
Okay.
Because I just tried to extend his hip and he really didn't like it.
Good.
But actually,
All right. Shh, shh, shh.
bending his knee
Steady.
is fine. All right, champ. All right, mate. Oh dear.
Good.
Oh dear. Oh, that's still nice though. Oh, that's nice. I know. You're saying, I'll give you a kiss. I might nibble your ear off though if you do that again. Hey, oh, what have you done?
He loves this.
The way that Pablo is behaving and being so painful, I really think we need to push to the next step, which is x-rays. All right, you give Mummy a kiss.
Good.
Come on then, champ. Okay, break it up, you two. Naomi is obviously an incredibly dedicated owner. She wants the best for him, but he is a little baby and she's going to be worried about him. All right, you grab a seat.
Yep, no problem.
See you in a second.
Okay. When you hear your baby scream, when your baby cry, it's never very nice. So I'm just hoping that Scott can help him today.
Hey guys,
Hi.
this is Pablo.
Hi, Pablo.
He has been described by his mum as a little bit of a tornado, quite
buddy.
the handful, and been quite calamitous across the course of his life. He got attacked by a staffy, bless him, when he was about 10 weeks old. He's had a little bit of lameness, his mum said, ever since. But last couple of days, he's been really, really sore on this hip. So in examination, it was really painful. So, but he's getting on quite well. He's putting his leg down, so hopefully it isn't anything too major. Hey, Mummy's waiting upstairs for you. Hey, so let's give her the good news, hopefully. Yeah? We have to knock you out first, though, don't we? Yes, we do. Yeah?
All right, think about this. Think about
Good
this,
boy,
buddy. Oh,
good
what a
boy.
good boy.
Oh, brave boy.
Oh, he's a very brave boy.
Brave boy. There we go. Now he's asleep, I can examine his hip properly without pain. But this feels way worse than this dog is presenting. He was skipping around, happy, enjoying his mum's cuddles, but feeling this hip, there's something quite serious going on here. So what I'm doing right now is just rotating his hip joint, and it's like a grating sound. Certainly not the beautiful, smooth, healthy joint that you would expect of a 6-month-old.
I've never left Pablo with anyone that I don't know, and I've only met Scott for the first time today, so I'm very eager to have my baby back.
She was spinning around the other way. Look at that, guys. Automatically, I see that's a problem. One long leg, one short leg. And look, it doesn't even want to stay out. Look, it's just tight. Okay, let's take these x-rays, shall we?
Oh, poor Pablo.
It's really quite unusual to see one leg shorter than the other. And in this case, I think it's caught us off guard because it just shows that this is a much more chronic injury than Naomi or I expected. Hi, Naomi. Thanks for waiting. I've got something I need to show you, so I think you should come downstairs. Okay. Come on down. So, I just need to show you these x-rays. It's quite a shock, actually. Yeah. What we're looking at here is an actual fracture, a broken bone in his hip.
Yeah, that doesn't look good at all.
No, it's not a clean break.
No.
So what I think may have happened is, right back when he was 10 weeks old, this staffy has really done a number on him, and this is actually broken at that stage. And then over the time between then and now, it's tried its best to heal, but done a really poor job.
Yeah.
And every time he clatters around the house and knocks stuff over, he's re-breaking that.
Every time.
Yeah.
Okay.
So now I need for you to be brave because we need to do surgery on this leg. All right. I think what we're going to need to do with Pablo is perform something called a femoral head and neck ostectomy. It's basically removing the ball from that hip joint and just leaving a free-floating joint, and the muscles would take on the stresses and the strains of that joint.
Whatever he needs and whatever it takes.
Okay. Do you want to say goodbye to your chap? He's just laying just here. So you can... He's asleep. He's out of pain. All right, you jump in.
Oh, bless you. I promise.
You'll be okay.
So all of these things all these things that you're seeing, it's just to help keep him asleep, okay? I know it's a little bit scary. The tubes are giving him oxygen and keeping him asleep, and he's got his drip on, and he's got various different machines to help us do our job.
Yeah.
Okay.
Okay.
I promise we'll look after him.
I know it's like seeing your baby under anaesthetic. It's tough, isn't it?
I'm feeling pretty devastated that Pablo's actually got a broken hip instead of just a little bit of a pulled muscle. My little baby, who I thought was a wimp, is actually a little hero.
You head off.
Okay.
And I'll look after your boy, and I'll give you a call as soon as he's woken up.
Okay.
All right?
Yeah. It's a complete and utter shock that Pablo has to have surgery. Probably my worst nightmare.
We'll see you in a bit then, eh? All right, come on out. So I'm just going to start scrubbing. Every animal that we treat is loved by their owners, but I think that there is a very special bond between Naomi and Pablo, a little bit like mother and son, and he is still a puppy, so he's like her baby. So yeah, maybe a little bit of added pressure. So I'm just about to make the first incision to expose Pablo's hip. I really don't know what I'm going to find. I don't know if, based on that x-ray, if the femoral head and neck are actually attached or they're separated. So it's only once I get in through all the muscles and then into the joint capsule will I know, and then I know what I need to do, which is to remove that femoral head. This boy's got some insulation. He's a little bit on the portly side, isn't he?
Just a little.
So it's basically cutting through the skin, through all the support tissues, through muscle, to get to the joint capsule, which is basically the bag protecting the joint itself. Yeah, I'm just going into the joint capsule, so I'm finally going to see what the hip looks like. Oops, it's full of blood. Straight away, I know it's way worse than I even anticipated because blood comes flying out of that capsule, which just shows how traumatic the injury has been for poor Pablo. I've got my finger inside Pablo's joint capsule and I can feel the ball of the hip socket is not attached to his thigh bone. And you might think, oh, that's great, you know, it's easy, you just pop it out. In fact, no. Because I can't lever it out using his leg, I have to go fishing for it. And that actually is, yeah, quite difficult.
Yeah.
Oh, God, it's so awkward. That's the muscle that's giving me so much grief.
Yeah.
So just if you can try and keep that out of the way, and then I just
Am
need
I
to
okay
give
to
you...
hold it like this? No. probably
Yeah,
not,
that's fine. It is so difficult because the round ligament, the ligament that attaches the femoral head into the socket itself, has sort of grown exponentially, and that's probably because there's been a history of instability, and the body's a very clever thing, so it's tried to stabilize the joint, and it's done that by increasing the size of this ligament. But for me as the surgeon trying to get it out, it's meant for a lot more difficulty. Oh, come on. Come on. Okay. That's that fractured femoral head that we could see on that X-ray. Oh, look at how thick that round ligament is.
That's insane.
After I've got the femoral head out, the next step is just trying to make sure that there isn't any bony contact between the thigh bone and the hip joint. Because if we get any grating or any rubbing, that's going to cause pain, and that's going to mean that Pablo won't use his leg. So I use what looks like a chisel to basically get rid of any bony attachments, little bony pieces, make it nice and flat, and that'll mean for a nice, comfortable joint. Just little bits like that that are going to rub. Great, I can start closing up now. It's a massive relief to be able to close up Pablo and have him wake up. Here we go. Oh, look. Mummy even dropped off your teddy bear. Look at that. Hey? There you go. Good boy. It's possible that there could be more complications with this procedure just purely because of how difficult it was to get the femoral head out. But I'm hopeful that I've managed to get it out without causing injury, but let's see how he recovers.
I've been feeling nervous, excited to see him, anxious that he's okay because I'm worried that he might be missing me.
All right, mate. Good boy. Look at you putting that leg down. What a clever chap. What a good boy. Hello, mate. Oh, gosh, you're crazy, aren't you? Hey, you're crazy. Yes, you are. Come here. Come on, then. Oh, let's go see Mummy. I think I hear her. Let's go see Mummy. Come on.
I can't wait to see him.
Hello.
Hello.
There's your chap.
Hello. Hi. To have Pablo back feels amazing. I can't believe how much I missed him and how much he obviously missed me. It's so good to be together again.
Okay, down you go, mate. There you go. Right. There you go.
Hey,
So
hey.
you can see already how brave he's been.
Look at you.
Legs already
Look at you.
touching the ground.
Hello. Let me see. Look at you, brave boy. Yes, steady. Good boy.
He's already putting his leg on the ground there, which is just such a great result. But now is your turn.
Okay.
So what you need to do is start with some physiotherapy. So the most basic thing is just to get him to use this leg. We need him to use it as much as he can, as quick as he can.
Okay.
So the first thing is just lifting the other leg up.
Yeah.
So when you lift the other leg up, just ask him to put pressure on that leg.
Okay.
But he's been such a brave boy and such a great patient.
Good.
And now you just need to convince your boy to use his leg.
Yes, he will.
Hey?
Yes. I can already see improvements with Pablo's leg. He's spreading his toes a lot more than he was before, and he's putting a little bit of weight on his leg, so I can definitely already see improvements. And I literally can't wait to take him home and just get my baby back. I love him so much.
All right,
Ready?
bye, Pablo.
Say bye.
See you, mates.
Say bye. Steady,
Take care.
Steady. Good boy. Good boy. Come on then. Good boy.
Good boy.
Pablo. Ready, steady, go. Good boy. Come on, Pablo. Come on then. Good boy. Good boy. Clever puppy. Come on then. Pablo is fantastic. He's making a good recovery. His muscle mass has started to grow a little bit more. He's using his leg fantastically. Anybody would think that nothing had ever happened to him.
This way. Where's Pablo? Hey, where is he? Hey, where's Pablo? Who's that? Hi, Naomi.
Hi.
How are you? Hi,
Good, thank you.
Pablo.
How are you?
Mwah. Good to see you.
too.
I thought I'd bring a little play date friend
Yay,
today.
We love new friends.
Yes.
Scott brought his puppy along so that Scott can see how Pablo can really move with other dogs, really see him in action. Also, it's really good socialisation for them. Go play then.
Wow,
Good
jumping
boy.
already.
Yes.
You're doing
Hello,
well.
darling. Hello.
He's looking very active
Yeah,
and
very, very active.
very comfortable.
Yes, I've got my dog back.
Pablo's moving really well, and most of all, he seems to be out of pain, so it all seems very positive.
He could never do anything like this before. His favourite time is coming out in the park. He
Yeah.
absolutely loves it out here.
can
You can
hear.
see. It's like he owns the place.
Yeah. Stop. Come on, you two. Play nicely. So often with patients, it's a mixture of physical and mental. And I think for him, he's lived pretty much his whole life with a sore hip
Yeah.
and not being able to use it normally. So now it's almost like you don't have a painful hip anymore. We just need to retrain you to use it.
Yeah.
And it's hard as an overprotective mum to
I'm
go,
terrible.
oh, my boy,
I'm
oh, he's
terrible.
jumping. But actually now, you need to just let him go
Let him
for
do
it.
it. Definitely. Definitely. The future for me and Pablo is to just enjoy a long, long life together, hopefully. Lots and lots of walking, lots and lots of treats, and lots of cuddles.
Come on, Scully. Good girl.
Pablo!
Come on.
Pablo!
They're already falling out. It's only their first date.
Good boy.
What are you saying? Let's look at this lumpy bit. Yeah, it's a real big lump, isn't it?
We were actually on a yacht off the coast of Corsica when it happened, and I got a call from Scott's practice to say that Bella had obviously suffered major trauma to her tail and that in all likelihood she would have to have it amputated.
Doesn't hurt, does it, Belle, when I touch your tail? Eh? Does it?
I don't know, I was in shock really, because when you're on a boat off the coast of Corsica and your phone goes, you don't really expect to be hearing that sort of news.
It's probably your curiosity that got you into this scrape with your tail, wasn't it, Bella? But we'll never know, will we?
The bad news was that the tail is badly dislocated, but the good news was that she had no other injury.
Nobody's going to see what a lovely tail it was when it used to stick up from her body at 90 degrees, and she was always...
She's been, really crying loudly and making her discontent known.
Okay, come on then, Belle. Come on then. In you go. Good girl. Right. There you go.
So it's sad, but I'd rather have her safe, and she's got, I don't think it'd bother her at all, actually, because she's just that personality, but I think she'll just take it in her stride.
Okay, Belle, make yourself comfortable because now we're off, okay? Big adventure, Belle. Come on then. Come on, Belle. You're coming to see Scott, aren't you? Come on. Yeah, I know.
Morning,
Hi,
Kathy.
Scott.
Hi, Bella.
Hello.
Hi, gorgeous girl. Come on in.
Say hello to Scott.
Hello, beautiful. How's things? So it's been about 3 weeks, isn't it, since we've seen each other?
Has, yeah.
How do you feel things have been going?
She's been her usual demanding
Yeah.
cat with attitude self, jumping all over the furniture.
But we've still got a very floppy tail, haven't we?
Yeah.
To actually dislocate a tail, pull two vertebrae apart, that would have really hurt, and would have been done at quite some velocity. So generally it's a cat that's run, got caught in something, been run over, kept running, and the tail dislocates. What I'm going to do is just do a quick deep pain test. I'm digging my fingernail in there and there's not the greatest of response there. She should be really quite painful, and the fact that she isn't would suggest that there's a level of nerve loss or nerve damage. This tail, being that it's not being positioned properly, can be caught indoors, can be caught on fences, can be caught up trees. If she has a good tug on that again, it can go from a significant injury to an absolute nightmare. So I do think in this instance that it is probably the best option to consider amputating the tail.
If we don't take it off, every time she goes out, I'll probably always be worried that something's going to happen to it and happen to her because she can't control it.
So that's exactly where we'll take it off from that point.
Right.
The risks of doing this procedure are that as there is a huge amount of nerves at the base of the tail there, you can damage their ability to do things like control anal tone. So it might be, in worst case scenario, that she becomes incontinent. That's the worst case scenario. Bella's surgery is a tricky one because of where the dislocation is in relation to her bottom. The base of the tail and where that is very, very close together. And there's a huge amount of nerves in that area. And if you cut the wrong one, you can stop her feeling that back end area and you can lead to lots of problems, incontinence being one of them. And that's the last thing we need with Bella.
So you're poor little Belle. But you're going to be fine, aren't you, Belle? Because you're a tough girl, aren't you?
Tough
Yes,
cookie.
you are. Yeah. It's funny, she's quite comfortable. Normally she doesn't like to be held by someone who's decided to hold her. She doesn't mind if she's decided.
I know, you're being affectionate to the guy about to take your tail off. Not a great choice. But at least she obviously trusts me, which is nice, isn't it? Yeah?
Here she is.
Hello, Bella. You're being
Hello,
feisty. Hey? You're not very happy now, are you, with that horrible
No.
catheter in?
No.
She's so beautiful, isn't she?
Yeah, she's a lovely girlie.
Look at the eyes on it, hey? They're amazing. It's such a shame. Take that beautiful tail away, but it's just floating in the breeze now. It's just an accident waiting to happen, so definitely the right thing to do to remove it. Doing a surgery like this on a beautiful cat, it is heartbreaking when you have to change their appearance forever. To remove such a beautiful appendage is a real shame. She's a beautiful cat, it was a beautiful tail, but she will continue to be beautiful even when the tail's gone. Yeah, it's a procedure that I'm a little nervous about because it is a massive change for Kathy. The Bella is going to look completely different, but I definitely need to make sure that's the only surprise in store. And if a cat gets incontinence as a result of this procedure, then very rarely does the cat survive. Perfect. Good. There we go. Right.
Let's go.
Last time we're going to see this tail where it is. Quite a nerve-wracking one, this just purely because we've got a dislocation that's just so close to the base of the tail there. Lots of very important things in that region. Very, very high up.
Yeah.
Probably one of the highest up I've ever done. And bloody close to this poor little girl's bottom.
Yeah.
I had a cat through university that had a tail pull injury, and sadly after 2 weeks he was unable to control his bladder and his bowels, and he did have to get put to sleep. So I know the heartbreak of this type of injury and when it goes badly, and I definitely don't want that for Kathy. So I'm just to the point now where I'm about to sever the spinal cord, which is obviously a nervous moment. You want to be damn sure that you're in the right position.
we go. It's off.
Yeah, sorry, sweetie. Right, let's get this closed up now, shall we? Kathy tells me that Bella is quite the fighter. I feel that sort of tenacity is really going to help get her through, recover from this surgery and go on to live a happy life.
Beautiful. Even with the little tongue.
Yeah. What's that?
All right, Bella, what a good girl. Let's have a quick check. Hey, I know you're not happy about that collar, are you? I know, but it's got to stay on, sweetheart. I'm very sorry. I apologise. We took your tail. We're taking your dignity slightly. Good girl, good girl. I know, and keep your nails to yourself, please. Good girl. Bella, now, that's not going to work, my friend. Can we leave the collar in place for 30 seconds? Unlike the one you destroyed overnight. She's eating, she's drinking, her vitals are all within normal limits, everything that we'd expect. She's had a poo, which in the nursing world is thumbs up.
Hey, Kathy, how you doing?
Scott.
You all right?
Yes, I'm fine. How are you?
Good, yes, very well. And so is your girl. She's just through in the consult room,
yeah.
so follow me
Great.
through.
Yeah, I'm excited to see her. Hello. Hi, Belle. It's been a big adventure, hasn't it, Belle?
So true to form, she's been quite the performance artist overnight. She absolutely ransacked her cage. She had this pulled off, but thankfully, she's left herself alone. So this is her
All right. Oh
new
my
look
goodness.
back end.
Oh my gosh, that looks great, doesn't it?
So you
It
can
doesn't
see it's-
even look like she's had surgery. So I was really amazed, very pleasantly so, to see that it all looked so good. I mean, it looks like it was done, a couple of weeks ago. The hell? That looks great.
But I still think her name applies, and that although she doesn't have a tail, she's still Bella. She's still beautiful.
She is, yeah.
And
But
I'm sure.
She looks great.
I'm glad that you're happy with it because
Yeah.
it's a
Gosh.
strange looking back
Yeah,
end.
but I mean, her fur will grow back.
The fur will grow back, and it'll literally fade away. And certainly from this cat's point of view, she's a feisty little madam, aren't you? And you're going to be absolutely fine, aren't you? Yes, yes, yes. Get me out of here before they take anything else off. I absolutely feel like we've all made the right decision. Not only does Bella seem more comfortable now the tail's gone, but it means that her future is secured and now she can go out and about and enjoy the great outdoors yet again. And Kathy can be sitting resplendent on her couch, sipping a nice cup of tea without a worry in the world. All right, all the best. Bye, Bella.
Bye, Bella.
See ya.
Bye-bye.
Bye.
Hey, Mr. Lucky. Mr. Lucky. Bella, she's the boss, and generally it's quite a loving relationship, except that she can be quite horrible to him sometimes. She can spit at him 1 minute and then turn round and give him the most lovely grooming and lick his face. Oh, Bella, that is nice. Mr. Lucky just has to put up with what he gets. Everything has to be on her terms, really. He's obviously okay with it. Actually, I haven't forgotten that this is the cat flap. Big adventure. You can go out again. Yeah. Yeah, you're just familiarising yourself again with everything. She's just loving it, and she's just, her confidence, hasn't taken a dent at all. There you go, back in one of your favourite places, aren't you? She's always been a small cat with a big attitude, and she's exactly the same.
Hello.
Hello, Scott.
How are you?
I'm very well, thank you.
Good.
How are you?
I'm very well. I'm very much looking forward to
Good.
to seeing your beautiful girl.
Well, I think you'll be very pleased with her, actually. So come in.
Thank you very much. Let's have a quick look at this and just see. That looks great, doesn't it? I mean, obviously it looks a little odd, but The fact that she's functionally okay and toileting okay as well, that's not been a problem?
No, not at all. Yeah, she hasn't lost any confidence.
The fact that she seems completely unaffected by it, don't you? Hey?
You're still a total flirt, aren't you? Yes, you are. Yes, you are.
I've no regrets at all, and I think if any other cat owner was in a similar situation, I don't think they'd have to worry about it. It's just nice to see them going off and having adventures, but it's nice to see them coming back safely as well.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.